So, ma'am, you can
Yeah.
start now.
Yeah, I was just about to say, I think we should start. We have some participants that have joined, and hopefully the others will join shortly. All right. So, thank you all of you for joining this webinar. Um, I think what I really enjoy in the past, the ones who might have joined me before, is that I really appreciate the interactive nature of this webinar, and essentially also reaching out to participants who are not from the social sector, who are learning concepts that they may have heard of, but we unpack them during the course of the session. So I really appreciate any questions or comments that come my way during the session. So I'm happy to answer that. Just a little bit about myself, in case you're listening to me for the first time. I have close to 12 years of experience in the social sector. I started out as a PhD researcher back in 2011. And yeah, so it's been a long journey of understanding how social sector programs are implemented, how they have gone through a significant change over the years, and how donor led changes influence the way in which impact is being measured. So, on this note, I want to just introduce the topic that we'll be covering today. I'm going to cover theory of change and log frames within programs. And the reason I chose this, session title is because I think there is some confusion among social sector professionals. Should we use theory of change? Should we use log frames? Are they, kind of synonymous? So, I want to go through it point by point, and it is a technical way of looking at programs, essentially to ensure that there's good tracking and there's good evaluation of what you do on the ground, so that the beneficiary is the one who wins in the end. Okay, so I'll just quickly share my screen. Let me know when you can see it. Somebody quickly confirm if they can see this.
Yes, ma'am, we are able to see.
Okay, great. Thank you. So let's start with the definition of theory of change. By itself, what theory of change means that there is, an intervention that you planned, let's say a project or a program or a policy, but it is understood to contribute to a chain of results that produce the intended or actual impacts. So what does this mean? That you are mapping out this theory of change, and you're using this program as a way to see from the beginning to the end what is the impact going to be of a certain theory or a hypothesis that you may come up with at the beginning. We all have a certain worldview. Donors have the same. Donors have the same picture in their mind, that they want to see, healthcare innovation happen, or they want to see education, reach to the poorest member of a remote village. They have a certain idea. The idea of a theory of change is to ensure that this hypothesis or this belief that somebody may have reaches the impact that it requires, with a plan in place for a project or an overall program. Okay, so I'm just going to see. Are you not able to hear me?
No, clear, ma'am. We are able to hear you.
Okay, great. There's somebody called Harinder. Harinder, you may want to check, the network at your end. All right. Okay. So moving on, this is an example that I will be reflecting back on through as I move on in this, webinar. So, my PhD back in 2010 was on migrations in India, where I understood a lot of how informal workers, function. When I say informal workers, I mean that they don't have a formal employment, but they work in the informal industry. They may be sweepers, they may be, working as handyman, they may be working as, a maid in the household. So that there's domestic work, there is, domestic labor, there's migrant labor, there's construction workers. It's a whole gamut. Informal work covers a whole range of, professionals who don't have formal employment. With lack of formal employment comes a lack of legitimization of their identity, which means that often they do not have any, access to any social service. And this became very evident during the COVID-19 pandemic, when, a lot of informal workers were denied their wages. Their employment was suddenly, terminated, and they were asked to leave, or they found themselves walking on foot. I think everyone remembers the visual of so many migrant workers walking on foot because of transportation being, stalled back home to their villages. So this is an example I'm trying to give. I'm painting this picture so that some of you who are not from the sector are able to see where I'm coming from. So for informal workers to have a dignified life, they need access to free and good quality social services. Okay, so this is my theory of change. This does not mean that this is the only theory of change for informal workers in India, or for a particular program. So here, what am I missing? Can somebody say what else do you need in a dignified life for informal workers that has not been covered in this statement?
Can we say earning like regular living? Yeah.
Right. Yeah. So regular wages, right? In addition, they also need, any mediation in case their wages have not been given to them, right? Similarly, they may need, support systems, emotional or mental support systems, right? So over here, a lot of things have not been covered. But the point is not that you cover an entire gamut of everything. It's just that you give a slice of your theory of change and put in place a log frame or a framework that helps you achieve the results that you wanted to achieve when you put the statement in place. Does this make sense?
Yeah.
Okay. All right. Thank you, Bhaskar. So I've come up with this, kind of a theory of change for me that I think, and of course, this is also implemented from having known a little bit about the sector. There are certain accident policies that the government has rolled out in lieu of the fact that there are a lot of informal workers. So there, some of it is true, but some of the thing is more idealistic. Okay, so the agenda, the objective is to provide dignified life for migrants or informal workers, right? In this case, there are two aspects to achieving dignified life for migrants. One is social services, and second is giving them agency. Okay, now within social services is very broad. So I've given a definition: provision of health, education, and financial support during work. So again, I have created an assumption that this is something that they will be given only when they are employed or gainfully employed. If they are out of work, if they are at home, these social services are not available to them. Similarly, agency, which is structural and individual support, which is given at work during the time that they are present at work. Okay. Now, within social services, I've further broken down my theory of change by providing two important pillars. One is insurance and access, and second is quality of care. Okay, so when I say insurance and access, I say provision of interest-free loans, okay, for education, access to hospitals for critical care, and the third one is access to a life insurance policy. Okay. Now, the quality of care, I have given two facets to it. One is up to two free OPD visits with under 1 hour wait time. Okay. And the second is 80% discount for critical surgeries. Okay, so in order to achieve dignified life for migrants, I'm saying these things are an important pathway to ensuring that they get these specific things to prove my statement, which is that they get access to free and good quality social services. Okay. Now, the second aspect, or the second component of my theory of change is agency. So I'm saying not only do they have social services, but they also have agency to get these social services. So when I say structural agency, I'm saying that the government is supporting them, meaning that it's not employer driven and the government is the one that's providing accident policies for them. This is actually true. There's only a 1 rupee a year that workers with certain criteria are able to acquire in order to get up to 5 lakh coverage. So there is an accident policy in place. And in addition to that, there is a qualitative indicator that I've included here, which is called safety and voice. So anonymous complaints against perpetrators. When I say perpetrators, if there's been a harassment case, they need to be able to submit a complaint. This is individual support at work, okay? And this is something that can be implemented at a project level. And then second is a proper inquiry in case of harassment. So let's say if the complaint goes into an inquiry mode, they get the case is tried for harassment at the individual and at a structural level. Does this make sense?
Right. The education you're talking about is for the children, right? It's not for the family.
Yeah, you mean under social services, right?
Huh.
Yeah, so again, so this is the thing that, here I've kept it broad enough for you to also interpret it in a way where, you can include more things, given that. So the theory of change is not necessarily something that will give you a planning tool for specific projects under the programs. Okay, so yes, it could be education for the children. It could be upskilling for the laborers. It could be education for women workers. It could be life skill training. It could be so many things, right?
Okay.
This theory of change is frankly something that you start off with when you are looking to when you're looking to make an intervention happen. But when I say this, I don't mean that a theory of change is set in stone. Theory of change is something that keeps on evolving. And this brings me to my next point, which is the 3 dimensions of a TOC, which is a way of thinking. So it starts with critical reflections on why you think what you think. It's definitely evidence driven. So you provide a lot of evidence as to why in this migrant case, why are you doing what you're doing? Maybe they are not getting social services, right? You have data that is telling you that. Then there are assumptions. So you're making the assumptions that this is the most important thing they need and not the other things, right? They may not need mental support right away. They may not need education for their children, but they need what they need at work first. Those are assumptions. Then contextual factors, for sure, it's important to understand, are there any trade unions in place? Are there any other support structures in place? Are there organizations doing similar work in the region, right? Within the geographical areas, what are the possible what are the possible barriers that can come in order to achieve success of this program? And importantly, what are the outcomes you're expecting? It's very important to reflect on that at the theory of change level, so that you are budgeting for it at the program level, but also you are seeing this in the big picture perspective. Okay, the next is process, and process is something which is very, very important when you're developing theory of change. Doesn't happen by 1 or 2 individual, the board member or the CEO sitting and putting it together. Stakeholders are very important in order to ensure that the theory of change is the all-encompassing in the way that it should be. As I just said, it's an iterative process. It's not something that happens overnight. It happens over a period of time, and that doesn't mean that it need not be revised after a financial year. It can be revised based on the results you get from that year. So let's say that if we go back to our example here, And we find that, this up to three free OPD visits with under 1 hour wait time is seeming like a very, very unachievable target at this point, given that certain structures are not in place, there are certain problems. You find a way to write it differently in order to ensure that the next year you get better results from the intervention you have made. Okay. And then mapping activities. The process is that you map out activities in such a way that it helps you in some ways move closer to your outcome goals. Okay. And the third dimension of a theory of change is a product. So it has become very important to visualize what you're thinking about. Just like how I did it in this visual, it's important, and I think organizations more and more are looking to use charts and they want to use diagrams that help and visualize the journey from start to the end, and explain the what and the why, like what is it that you want to achieve and why do you want to achieve it. So the actions and the impact have to be explained in the product, right? So this is something, again, the theory of change is a concept that is being used by many different international donors and international organizations, which is why it has trickled down to a small grassroots organization having to report on certain indicators, because it has been mandated by a UNICEF or a Rockefeller Foundation or a BMGF and so on, or a DFID, right? So a theory of change is a foundation of an outcome-based approach that drives an initiative or an organization. See, you have to understand, it means to some of you, it may seem like, it is a very, high level thing. It seems very theoretical. But as I move forward and I discuss with you, I discuss a little bit on the outcomes, on the Logframe, on the planning tool that I'm going to show you, you will see that, this is a marked change. Earlier, there would be people who have some money, they would donate that, X amount of money, and they would not really look at what is the outcome that we are going to achieve by donating this X amount of money. But the theory of change is pushing these individuals, and not just the organizations implementing it. It's pushing these individuals to realize that, we need to think about what is the statement we want to make from having donated this money, and how can we enable organizations to ensure that those outcomes are reached by them and they feel motivated to reach that outcome as well. So it is starting the project with that outcome based approach of thinking, right? So as a process, TOC is described as an approach to thinking about change realistically and communicating how change is expected to occur. And as a product, TOC is a document. So you submit this as a document, like I was explaining earlier, the example that I gave, which explains the underlying logic of an intervention and explains how the progress towards goals will be monitored. Okay. So it's very important that this progress towards goals is continuously monitored. And see, typically in a financial cycle, it starts at the beginning of the financial cycle. The monitoring, which comes in the way of how you against all of the different indicators you identify within your project, how you're monitoring it at different times. So there is a baseline that can be established that, okay, 80%, like I said in this, 80% discount for critical surgeries have to be, provided. So that's a baseline you have established. Now you have to conduct a midline survey to ensure that this baseline 80% is met or not, right? So there is a continuous monitoring that this, having a theory of change means that you can achieve. So what is the ultimate outcome that you want to achieve? What is the long-term outcome? So these are different ways of looking at it. Frankly, I think the precondition and the long-term outcome are things of breaking down the outcome itself in order to ensure that you are able to really meet the last mile beneficiary within the area that you are most focused on donating on. Now, what is a Logframe? Sorry, I'm just going to stop here to see if anybody had any questions.
I'm one question.
Sure.
Okay, go ahead. Go ahead.
What is the long term? I mean, how long is long term?
Right. So that's a really good question, because a long term can be done in a way where it can be up to a year, and the long term the time frame of an outcome is something that is decided by the organization itself. So it need not mean that it can be an annual process. So, for example, impact is also a yearly target typically, and long term outcome can be an annual target. So again, it's very important to remember that none of the terminologies that are presented here is something that applies to everybody. Okay, so it's important to understand that it uh, changes from an organization to organization, funder to funder, and it's usually something that is determined by them, keeping in mind the partner organizations and implementing partners.
Okay, thanks.
Yeah. Somebody else had a question.
See, the stakeholders which you mentioned in the previous slide,
Right.
there it's only the organization, right? Or because the actual beneficiaries cannot be at this point roped in because
Right.
they are
Yeah.
unorganized, right?
Right. Yeah. So great question. Great question, Bhaskar, or right?
Yeah, correct.
Right. Thanks. So when I say stakeholders in the theory of change, yes, beneficiaries. If you're looking at local leaders, maybe they can be included as a part of a benefit, as a part of stakeholders. But I would not say at this point a beneficiary who um, you know uh, is getting the final result of the intervention can be included. Why is that? Because many times a beneficiary also does not know what the organization or the donor is trying to achieve towards the end, right? They may say, you may go with a proposal to them saying that, oh, we are trying to ensure that there's up to two free OPD visits. They said, इससे क्या होगा? हमको खाना दो, हमको न्यूट्रिशन दो, हमको ये सब नहीं चाहिए, right? So that can really derail your process of ensuring that your theory of change is mapped out correctly. So stakeholders, yes, does not include last mile beneficiaries, but it can include local leaders who provide contextual information,
Okay.
which define the way of thinking.
Okay. Yeah.
Okay. All right. So I'll move on. So when we talk about how do we implement theory of change, a very common way of doing it is through a log frame, okay, or a logical framework. So there's a definition I provided below, which is that a log frame is a tool for improving the planning, implementation, management, monitoring, and evaluation of projects. The log frame is a way of structuring the main elements in a project and highlighting the logical linkages between them. The logical linkages is very, very important, because the stakeholder question that I just explained is something that comes up again and again, right? If you go to the same donor with the same with your project results, they're going to say, if you want free OPD visits, 2 free OPD visits, how is that going to influence the long term well-being of migrant workers in place A, right? And you are saying, it's providing them the social services that they need in order to ensure that they are they are able to have some agency, right? And that is the logic that is the crux of a logical or of a log frame. Okay, so a log frame was established in 1960s, championed by donors who to guide the project design. So this actually is right in the middle of project design space, and this is what I was telling Mukund earlier about how there is no one type of log frame, just like there's no one type of theory of change. It totally depends on the donor's requirements, right? And what types of results they want to see. Is it the ultimate outcome that they're most interested in seeing, or are they looking at intermediate outcomes as well? What is the kind of monitoring they're requiring us to do? And which is the design team in place? So this is another thing, the understanding of the design team of the intervention of the theory is very important in order to that influences how the log frame is conducted. And now I'll explain how when I show you what a log frame can look like. So see, this is an example. I'll go back to the slide I missed. So this is an example. These are only three components of the log frame: the activities, output, and outcome. Okay, so the design team in this case said, okay, these are the three most important things that we want you to track and monitor over the course of the year that you are getting X amount of donation. And I don't want to hear about anything else. Okay, but that doesn't mean that this is the all defining log frame. There can be a different design team that will say, this is not enough. We need to do more and more, monitoring on how the data is being verified, what are the risks and assumptions that it started out with, what are the objectives and what are the goals of this program, and what are the objectives of this project. Okay, so this is something that is very important. And again, to come up with a log frame, it is very important that sorry, 1 second. I seem to have missed one. I seem to have missed one question. So I'll get to the question shortly. I'll get to the question now actually, because it's on theory of change. Is theory of change at the planning stage before implementation or afterwards, after the start of the program? Please explain. Yes, great question. Thangavelu, very good question. So theory of change is something that it's even before the planning stage, right? Planning stage, LFA is when, LFA is the tool that is used for planning and implementation. But theory of change is to establish, the final impact of a project. So this comes, theory of change, in my opinion, comes before LFA, or maybe at the time of putting the LFA together. So that is really important. All right. So I'll move on. So the tools for LFA itself, right? So this is really important because, there are many ways of, getting into how you establish the LFA. I recently did a pretty large project of defining the LFA for 3 different entities of an organization, 3 different charities that they had. And, the most important, the most difficult thing for an outsider to do when you're defining the, problems of how the project is currently being monitored and how it should be monitored, is to have the team reflect a little bit on what are the root causes that you started out with. What are the root causes within the communities in which you are doing the intervention? What are the effects of your intervention, and what are the possible solutions that you can come up with, right? So, the point of contact I have, he suggested that, we do a problem tree analysis with 6 different groups in 6 different locations. And this was a very interesting exercise because there are very different results from the problem tree analysis. So while some teams were most focused on the root cause itself, some teams were very confused about the effects itself. So to give you an example, one of their projects involved, implementing a learning education. It was an education-based project, and they plan to improve the learning outcomes of students from 1st grade to 5th grade. Now, the root cause was that the education standards were very, very low in the areas in which they were working. But the effects of the interventions, they did not have enough data to say that, based on the intervention, this is the effect it has had, right? And that made the team question that how is it that we don't have enough data to show that even though the qualitative data is telling us that, they are doing a really good job of influencing positive learning outcomes, but really the long-term data they had was not as conclusive. So then they began thinking about solutions that, oh, maybe we need to get an external agency to do an evaluation of the program at baseline, endline, and midline and endline, and then compare it over the years to see, how the area is being able to improve in the way that the children are, learning in the early years. Does this make sense? Okay. And then I also, the other tool that we've used is also stakeholder analysis. So sometimes what happens is that during the LFA activity, you realize that there are some stakeholders that have been left out, right? So for example, a school teacher or a headmaster who could be involved in that education intervention has been left out. So it's important to map out those people in order to ensure that the activities that you're charting is done in collaboration with them. Then discovery workshops with the team, which is this is also something in this project which lasted for about 3-4 months. I did in-person workshops. So this involves also empowering the team to create the LFA themselves, right? So you explain what the different components of the LFA, how the activity is done, what are the outputs, how the outcomes defined. If they have a certain understanding of the outcomes, you kind of nudge them in a way where you say that, you need to define it even further, and so on. And then there's a preference ranking that it's also a tool that's used for LFA. So also keep in mind that these are all tools you do before you actually sit and plan for the program. So this is to get to the bottom of the problem, to help the team reflect on what are the gaps in the way they're monitoring the program, and have them participate in improving how you are doing things, or to set a process in place to begin with, as the case may be, where you set out the problem, you put it in writing, make a report, and then move on to identifying what the LFA should have in all of it. Okay, so now the example of the migrants, of the informal workers that I had given at the beginning. What are the activities that I have set out to do? So the activities I put in place are capacity building workshops for the informal workers, and collaborative programs with different stakeholders. Okay, these are the two activities. Output that I want. Now, output comes before outcome. Okay, please keep in mind that these are important things. Typically, what a Logframe has is activity, input. Inputs are resources that you put in. Output, outcomes, impact. And then I'll move on to other things that are also very important. So in the capacity building workshop, we want to, the output we are expecting is a high percentage of informal workers that have noted positive CAP score. What is a CAP score? CAP is knowledge, attitudes, and perceptions. So their knowledge, attitude, and perception towards, their, receiving free and good quality social services, understanding of what that means, understanding that they have agency, those are things that you expect out of the capacity building workshop. Okay, that's the immediate output you are expecting at the end of the workshop. So how do you do this? You can do it in a survey form, where you ask them what do you think about, what do you know about the accident policy, what do you know about the service of getting 80% discount on critical surgeries. And then right after the workshop, you ask them, have you understood this? What do you understand about this? What is your perception towards this? And the idea is to put it in place in the Logframe that they receive a higher percentage. You make sure that the program teams know that this is the quality of capacity building workshop we expect, so that there is a high percentage of people feeling positive about what they learn at the workshop, right? And then collaborative programs I've said high rate of participation among all stakeholders. Okay. Now outcomes, usually it has to have a one-to-one relationship. Here I have not done that. So what does this mean? That there's a 50% improvement if they know what the social services are being offered. Then 50% improvement in healthcare in case of injuries at workplace at a quarterly level. So you want to ensure that not only is the system in place, but the people who receive the care also know where to go to. right? So that's what you're covering in the outcome. And you also improve the outreach among stakeholders. So let's say, like I was saying earlier, there are some stakeholders that may be left out. So the outcome you're expecting from this activity is that you have improved 80%. So areas where there was, for example, no outreach done before, you map out those areas, and in the outcome you establish that 80% improved outreach among the stakeholders. Does this make sense? I just quickly check the comments. Sure. So somebody has, Mukund has asked me a question. Do you need to verify that the logic of the root cause analysis is accurate? Otherwise, it may be a subjective picture or view of the issue. So, Mukund, very good question, and thank you for putting that in the chat. Now, the logic of the root cause or logic of why the root cause is what it is verified by the evidence in place. Okay, so let's say if somebody is saying that, ma'am, like from my example of, the education program, they are saying that, the reason children are not coming to our schools is because, there's a very high rate of girl children getting married off before they turn 18, right? Now, I can easily check the NFHS data and see if this is accurate or not, right? So there is this, it's true, it can be a very subjective picture of the field worker, of the program, implementer. But really, this goes back to your theory of change, that if you want to influence, this population, why did you start doing it in the first place? So it has to be driven by data and evidence of the region and the contextual understanding of the place. I hope that explains.
Yeah, thanks.
Yeah. Okay. And then VS Varun has said, can you please expand on CAP again? Yes, I'm so sorry. I went through that really quickly. So CAP is actually a very commonly used survey tool. It's called knowledge, attitudes, and perceptions. Now, what people have seen when you implement a program. Let's say that you implementing putting together, you are installing toilets in place A, B, and C. Does this mean that people are going to use those toilets as well? Their sanitation conditions are going to improve, that they are going to promote good sanitation in their communities? No. So it's very important that when you do an intervention, you are looking at how the knowledge of a certain intervention, has the knowledge changed for people? Has their attitude towards sanitation improved? So people who are used to open defecation, are they using toilets now? So has their attitude changed? Are they also pursuing that for in the long run, or is it the same? And then perception, right? The perception of the intervention. Do they think, okay, ye free mein ye toilet dal rahe hain, so let it be? Or are they saying, oh, this is an opportunity for us as a family and as a community to change how we are doing things because it's unhygienic, right? So it's important. This CAP survey was established because they wanted to study behavior change, and in the end, social when you social science requires that behavior change be measured. So CAP is a way of understanding that. I hope that explains.
Thank you.
Yeah, no worries. So Thangavelu has asked me one more question. He said, input equal to activities, or are they two different things? So yeah, no, they're not clubbed. Absolutely not. So an input is something that's a resource. Okay, so in this example, capacity building workshop ke liye, that's the activity. What is the input? You need human resources, right? You need a trainer who will train the informal workers, right? In addition, you may need a classroom space, or a space where there is a blackboard, there's a chalk, there are papers that are ensuring that the surveys that are done are maybe tablets used for capturing the survey data, right? And then in addition, you need a certain amount of informal workers, so you need you need those resources as well, that you have enough space for them to sit and so on. So those are inputs. Activities are just program activities that you plan at the beginning of the year, the financial year.
Thank you. Thank you, bro.
Yeah, no problem. Please feel free to stop me. I'm happy to answer any questions for you all. Okay, so this is the example, Logframe example. Now, purpose of the project. So this is what I meant to say, that I couldn't fit it, within the, the frame. That's why I have to break it down in. But typically, you cover the Logframe in an Excel sheet where you have one column which has a goal, the next column that has objectives, then you have activities, inputs, outputs, outcomes. Okay, so this is how it is done. Now, the purpose of the project, while like I was explaining, has to be the objective should address the core problem in terms of the benefits to be received by the project beneficiaries as a direct result of the project. A project will have multiple objectives. Okay, that is very, very true. You can have one goal, but you can have many objectives. And based on those objectives, you define the activities, the input, output, outcome. Okay, now what is the nature of these objectives? They have to be specific, they have to be measurable, they have to be applicable, they have to be realistic, and they have to be timely. Now, I want to take this opportunity to ask somebody to define an objective of this Logframe example. What is an objective of this example that I put together? If somebody can, volunteer and tell me. Can the objective, the goal may be that, you want to give them free and accessible. Sorry, yes, go ahead.
Education.
Right, yeah. So the objective is that the one of the objectives could be that you want to provide education and build capacities for informal workers who do not have any healthcare benefits at their workplace, right? That is the objective. So that's what a objective, but it has to be specific, measurable. So is this measurable? Yes, it is measurable. Applicable? Yes, it applies. Is it realistic? Yes, but again, if I say that they achieve healthcare, that may not be very specific or realistic. So you say hospital care benefits. So that way it is measurable and realistic and timely. So here I have mentioned at a quarterly level in the outcomes, right? So that is when you are measuring these outcomes at a quarterly level if you are able to achieve that 50% improvement in hospital care. Okay, so these are the smart characteristics within Logframe that are very, very important. And every time you are a part of a Logframe activity, it's very important to ensure that you don't you keep your team and yourself in check when you are putting it down. So what I find often when I work with clients on this is that they don't have it measurable, and also their teams don't keep it measurable because it's very difficult. Let's say that you're doing an intervention on traditional arts craft. How do you measure that an artisan has improved their capacity to deliver better products? Because art is art. How do you know that the embroidery is better, right? So keeping it measurable is sometimes really, really difficult for certain clients. So you have to continuously try and get them to think creatively when you want to make it measurable. So you can say you can think about the thread count, or you can think about improvement in business or improvement in outreach. Those are the kind of ways, those are called proxy indicators that you come up with in order to make sure that it's measurable against the objectives you started out with. Just quickly see my chat. Right. So somebody has said, what is a qualitative output? Santosh, did you mean what is a qualitative output?
No. There are what is not measurable can be measured on a qualitative improvement in the hygienic condition, health condition of the community involved.
Right,
That's what I
exactly. Yeah, absolutely. So there are also some. So when I say measurable, please note that at no point am I saying that everything should be quantitative. Absolutely, yes, we have to have a qualitative indicator. We can have, stories of change. We can have case studies of how, there has been an improvement in the way people have, you have to plan it out in advance that those qualitative outputs are measured and measured at a timely manner, so that the direct result of the project is also visible. So many donors often ask for photos for this reason, right? So they want to make sure that the photos capture what are the changes that has happened in the community. But that should not be the only thing. It should also be that, a little bit of the complexity of behavior change is also visible, if that makes sense. Right. Yeah. So, okay, I'll move on.
Is that you have written KP or KPIs, or is it you meant your previous slide, I think?
CAP score. Yeah, I had just explained this, Santosh, earlier. That CAP is the changes in knowledge, attitude, and perception. So that's the qualitative pieces of how a social change reflects in an individual or a group. Yeah. So absolutely, that is
Yes, okay.
a tool
That's
for.
fine, because I thought whether it is KPIs or
Oh, no. This is actually exactly what is qualitative in nature that a survey tool is trying to capture. So usually you have 1 to 5, and you have to tell people whether, to either select 1 or 5, so that the qualitative nature of it is captured, and you can, do a big sample for that. You can select a big sample size for that.
yeah, right.
Okay, assumptions and risks. This is one of the things that I found, when we did discovery workshops with teams, was the hardest, because hardest and possibly also the most important. I started out when I discussed the theory of change by telling you all that it's very important that you are not able to cover everything under the intervention that you want, right? Because there are certain assumptions and there are certain risks that you may not achieve output A or an outcome C. And it's important to have that in the planning stage mapped out, so that the teams are aware that this is an assumption you're making, and this is an assumption that we need to keep in mind when we are monitoring and capturing the outcomes. Mukund has asked me a question: can the measurement matrices be developed as project progresses, or it should be at the beginning? At the beginning, absolutely, Mukund. This is something that cannot change. So the matrices is something that, this is why we said it's a very this is why I said it's a stakeholder activity. It in by no means is something that one person develops. The stakeholders have to be in have to develop a consensus. I understand how difficult a consensus can be in many cases, and often very challenging when there are many conflicting notions about a project. But nevertheless, it has to be measured at the beginning. It has to be identified at the beginning and followed through till the end of at least 1 year, and possibly 3 years or 5 years, if the budget and the donations are in place.
Thanks.
Yeah. So assumptions in my case are the hospitals are within close vicinity of the workplace. The geographic areas covered may not have the support from the state. So there may be many factors why those geographic areas don't have the accident policy, like I was saying, which is covered under the central government but may not be covered at the state level for some reason. Or the local leaders endorse the workshop participation. Those are also risks that we are running, right? If the local leaders are not endorsing the workshop participation, then you want to ensure that you have them first as stakeholders before you move to the beneficiaries. And some assumptions are specific, right? Like the local leader example, and some are testable, right? Like the that you want to achieve a certain amount of participation in the, like I explained earlier. This one where you're saying that you want 80% improved outreach among stakeholders. So this is an assumption that this is an assumption that should be testable, that are there, how many stakeholders are there? First, that understanding needs to be there, and then you test out whether 80% of these many stakeholders have actually been achieved as an outcome. Okay, so this is the assumption and risk. It's looking at the time. Okay, we are well within the time limit. Okay, now source of verification. This is very, very important, and I think at an NGO level, I often see that there is a lot of missteps that happen because of lack of resources, lack of knowledge, and so on. So what are the sources of information or data to verify outcomes and accomplishments? So one is, so let's say that you achieve 80%, 50% improvement in hospital care in case of injury at workplace, right? If you achieve that, then how do you verify that data? You verify that through surveys. You do second set of surveys to validate whether it is actually in an evaluation cycle. If it's done by an external vendor, this is typically what they want to do. They want to make sure that, let's say, the internal team member has found that there is a 50% improvement, but is it actually so? And then again, surveys can have capped surveys. Like I was explaining, you want to understand whether you having a 50% hospital care, is it specific to certain communities or specific to all communities within the geographical area, right? Are marginalized communities like women or children, are they also getting hospital care, and why so all of these smaller details, finer details that may not be covered, you can cover through the surveys to verify whether the accomplishments of the project are actually what they seem. And sometimes it need not mean that it may actually negate what you've done. Sometimes evaluating outcomes can throw up a whole bunch of more interesting insights from the projects that may not have been covered in the Logframe to begin with. So sources of information, verification of source of information is very, very important. Then project notes, minutes, reports, records. It's very important. I think this is true of all the people who implement projects, that no amount of documentation is too much documentation. I think that is one thing that is established. Specifically, verification of outcomes and accomplishments can come in handy, especially if you don't have the budget to, let's say, get an external vendor. At least you can verify it through the notes and minutes, reports and records, that you may keep it at a grassroots level. And then, as I said, photographs, tapes, videos are often asked by the donor in order to verify the outcomes and accomplishments, but may not be very conclusive as they may seem. Let me know if there are any questions at this point. Okay, moving on. This is my last slide. Okay, how does the LFA help? I think this is one thing that a lot of you, especially some of you who come from the accounting background, will be interested to know that LFAs is actually something that is especially helpful to people in your field, because you are able to do financial planning and budgeting, keeping outcomes in mind. And this is very, very critical, especially in big organizations which give out big grants, is that they budget through the year for certain kinds of outcomes. For example, BMGF, Bill and Melinda Gates Foundation. BMGF typically gives money. These days, they provide grants to organizations who are able to use AI, artificial intelligence, chatbots and so on, to improve social impact, or to influence social impact, right? So if they have this agenda in mind, or if this is their theory of change, then they do planning and budgeting around that. And organizations who provide grants with, logical reasoning and, a good set of, indicators to help use AI for social good, they are able to get, they are able to qualify for these grants. Okay, and then at a program level, if you have a log frame in place, you are able to budget against each outcome that you will achieve. So hospital care, let's say that you have X budget, you are able to from the total budget, you start allocating percentages against that are attached to each outcome, and that helps to ensure that finally you send that to the donor and not the total amount of money spent for each projects, right? You are attaching it to specific outcomes. Then LFA also helps in writing grant proposals, because nowadays a lot of international grants that we write involve an understanding of the theory of change and a log framework. They want to know if you understand that it's not simply important that you're able to successfully implement a program, but that you understand the monitoring and evaluation mechanisms that exist, and that you are actually able to meet those, right? And then you can do baseline, midline, and endline surveys around the LFA that is decided at the beginning of the project. And the reporting is very easy when you have an LFA in place. Okay, with that, I think we are right on time. I've covered pretty much the entire thing on theory of change and LFA. Feel free to ask me any questions. Floor is open.
Ma'am, I have a question.
Sure, Mukund.
You had said that theory of change is the outcome oriented.
Yes.
Can we say that Logframe is intervention oriented?
Yeah. So I think that's a good way of putting it. I think LFA is also outcome oriented. But it is a planning tool for specific projects. So let me go back to this definition. A log frame is a tool for improving planning, implementation, management, monitoring, and evaluation of projects. So it is not just one thing, Mukund. It's many different myriad things that you cover. So, and definitely the intervention itself is a log frame is necessary for an intervention, but it is also necessary for the management of the project, right? And it is also a way to structure the main elements in the project and highlight the logical linkages between them, which I explained. So again, I would say that the two of them both are should be in an ideal scenario should be outcome based, but it can be something else as well. It can be differently, because what I often observe is that they are more output oriented rather than outcome oriented, where you're saying, okay, 80 X amount of money was given for hospital beds in X location, and the output is 80% patients use the hospital beds that were given, right? That were donated in this hospital. But that's not enough. Of that 80%, are the 80% the people who are most in need, who are the most marginalized, and people who had never been given hospital care before? We don't know that. So that's the reason why it should be outcome based and not output based.
Okay.
Namaskar, ma'am. Mrs. Janvi Kanakia ji, this is Rakesh Chaudhary speaking.
Yes,
Actually, I
yes,
wanted to know your views and opinions on the preferential ranking in scorecard indicators, apart from all the social activities, objectives, inputs, outputs, outcomes, and the impacts.
Sorry, what is the exact question?
So the preferential ranking scorecard indicators, evaluation and reviews for that parameters.
Okay, sorry, one second. Just a second. Let me just share my screen. I think my screen. So the tools for LFA that I was preference ranking stakeholder analysis, is that what you're talking about?
Yeah, yeah.
Yeah. So
Another log framework and another log framework.
right. Okay. So yes, Mr. Chaudhary, what I will say is just a second. I'm sharing my screen. Yeah. So here, what you will see is that these are tools for the LFA. So when you go into the activities outputs, what you often find is that the problem tree. You want to have the team reflect a little bit on how they are implementing programs, or how, in cases of teams that have never implemented programs before, or this particular program, you want to have them reflect on it. So you define the root cause. So for example, child marriage is very, very high in area A. So you understand that that is the root cause, and that the effect of your intervention would be that you reduce the total the child marriages by introducing education, or good quality education in the area, right? And the solutions you're offering is after school programs, free of cost education, good quality teachers. So those
That's the
are,
logical framework.
sorry.
That's the logical framework. Give value at risk for social projects, social activities.
Yeah. So what do you mean? Does it value?
Value at risk valuation.
Yeah. So the valuation and risk is not something that is covered under theory of change. It may
Thank
be,
you, ma'am.
it can be covered at an impact investing cycle, but not within theory of change for programs within the social sector. And impact investing is a whole different session. But thank you for the idea. Maybe that's something I cover in the next session. What are other popular tools other than LFA used at a planning stage? Great question, Bhaskar. There are many, many different tools. Honestly, Logframe is the most popular one. And as I said, there are so many types and forms of LFA that, I think most international organizations these days prefer an LFA. But yeah, there are many others.
Okay.
Thank you, madam. Thank you.
Thank you, Thangavelu. Have any of you been a part of an LFA exercise, or any of you have had to implement any monitoring, indicators? It would be nice to hear an example of this.
We have tried our hand at the theory of change, but
Okay.
not really logical framework.
Okay. And what were your learnings from there?
Quite a few learnings. It is a bit complicated. Number one. Number two, it is a team activity. It cannot be done single-handed. And it is like a live document. It is always improving and changing all the time.
Right. Yes, absolutely, Mukund. Very, very good learnings, very good, insights, because it's not some, because especially Mukund, you implement programs, right?
Yes.
Yeah. So
through Rotary. Yes.
At Rotary. Okay. So Mukund, why is it not possible to have a rigid log frame, if you can tell the group?
Okay. Actually, in Rotary, we were sort of surprised that what we had expected as an output or outcome was not always, you can say, the desired outcome. There were many other
Right,
results or activities. That is one part. The second part is we always used to find that our analysis of the problem was slightly different from, you can say, benefactors' viewpoint. But people who are actually going through that transformation, they have a different perception, as you rightly said,
right,
the issues. So that's why it cannot be a static document.
right.
Theory of change. Yeah.
Yeah, very, very good insights that, you know what, desired you are, it's very difficult to have a theory of change and have to implement it to the T, because many times this is what project implementers often experience, that what you started out with and what you ended up with are often very different, because the field level changes that happen continuously, like a new circular that has passed that has completely thrown off all the project activities you have in mind, or another competitor non-profit that has entered in the area and taken away all your participants or all your beneficiaries, then what do you do, right? And
Yeah.
those are real problems, and those are real challenges, which is why having assumptions and risks identified at the beginning are very important, especially if you are a smaller nonprofit, and and communicating them back to the donor is a very important step to take, in my view.
Yeah.
Thank you for sharing.
Yeah. And actually, through the theory of change, personally, I feel that we should look at the transformation, but very soon it becomes a numbers game.
Right. Yeah, but I think, yeah, that's a fair point, that it becomes a numbers game. But if you are covering a large set of beneficiaries, many different geographical areas, many different intervention areas and thematic areas, then it becomes important when you are, let's say, a project director or something, that you are able to see all the data all together. Nevertheless, it need not be one or the other. The qualitative data has to complement the quantitative data. So the
Yeah.
stories of change and the conversations from the field of the impact that they've had from the intervention, those are very important. But but tracking and monitoring it at a numbers level is important, because from the big picture perspective, it has to be seen in that way.
Yeah, I agree.
We have a few minutes left. In case there are any other questions, I'm here for you. People who've not talked yet. Some qualitative feedback will help here. Okay. If I can ask the host, then that we can end the session. We're almost at time. So thank you, everyone. I think this was.
Thanks a lot, ma'am.
Thanks,
It was
Mukund.
very informative. Yes.
I'm glad. I'm glad. And yeah, I am happy to share the presentation. Somebody's asked for it. So happy to share the presentation if the team takes it from me. So yeah, good luck and best wishes to everybody.
Thank you, ma'am. Thank you for taking
Thank you.
session.
Thank you. Thank you.
Thank you, ma'am. Thank you very much.
Yes. Thank you. Bye.